About the medical surgical nursing 2 for the GNM second years. So in this we are going to discuss about the unit 5, that is nursing management of patient with the disorders of ear, nose and throat. So there is a nursing management of patient with the disorders of ear, nose and throat. So we are going to discuss about the problems related to the nose. So yesterday up to the sinusitis we have seen, and next one is the nasal obstruction. So it is also one of the problem related to the nose, that is nasal obstruction. So today topic is nasal obstruction. The definition of this nasal obstruction, that refers to the some blockage of the nose and there is a nasal cavity and can be caused by a variety of problems. So the nasal obstruction means there is a blockage in the nose or the nasal cavity. So the obstruction means there is a blockage can be occur in the nose and the nasal cavity because of the some variety of the ప్రాబ్లమ్స్. సో వేరే వేరే రకాల ప్రాబ్లమ్స్ వల్ల నోస్ లోపల బ్లాకేజ్ రావడాన్ని నేసల్ అబ్స్ట్రక్షన్ అని అంటారు. సో ద నేసల్ అబ్స్ట్రక్షన్ డెఫినేషన్, దర్ ఇస్ ఎ బ్లాకేజ్ ఆఫ్ ది నోస్ అండ్ ద నేసల్ క్యావిటీ. ఇట్ కెన్ బి కాజ్డ్ బై ఏ వెరైటీ ఆఫ్ ది ప్రాబ్లమ్స్. సో ద నెక్స్ట్ కాజెస్ ఫర్ ద నేసల్ obstruction. So the causes includes the inferior turbinate hypertrophy. Inferior turbinate hypertrophy. So there is a turbinate means there is a some of the bones which can be present in the nose and it can be helps in the passage of air into the nose and there is a humidifying the air. So the turbinates can be help in the humidifying the air and passage of the air from the nasal cavity. So the inferior turbinate hypertrophy means there is a enlargement or the swelling of the mucosa of the nose and there is a improper position of the turbinate in the nose. So because of this there is a improper position of the turbinate bones in the nose and there is a enlargement or swelling of the mucosa in the nose. So because of this there is a obstruction can be formed and it causes the nasal obstruction. So the inferior turbinate hypertrophy means the turbinate bones can be present in the nose and it can be helps in the humidifying the air and there is a transfer of air into the by the nasal passage. So in this inferior turbinate hypertrophy there is a improper position of the turbinate bones. So the turbinate bones it can be situated in the abnormal position. So and there is a enlargement or swelling of the mucosa of the nose. So there is a inferior turbinate hypertrophy also one of the cause for the nasal obstruction. So the next one is the deviated nasal septum. So the deviated nasal septum, the septum which is present between the nasal cavity and that is bone and there is a deviated nasal septum. So because of this nasal septum deviated from the normal position to the side and it causes the nasal septal deviation and it is also cause the nasal obstruction. So the మనం ముక్కులో ఏదైతే బోన్ ఉంటుందో అది నార్మల్ పొజిషన్ నుంచి డీవియేట్ అయ్యి సైడ్కి చేంజ్ పొజిషన్ అనేది చేంజ్ అవుతుంది, దాన్ని నేసల్ సెప్టమ్ అని అంటారు. సో ద నేసల్ సెప్టమ్ డీవియేషన్ వల్ల కూడా అబ్స్ట్రక్షన్ అనేది ఫామ్ అవుతుంది. సో బ్లాకేజ్ అనేది ఏర్పడుతుంది. సో ఇట్ ఈస్ ఆల్సో వన్ ఆఫ్ ది కాజ్ ఫర్ ద nasal obstruction. And next one is foreign bodies in the nose. So foreign bodies like any insects or any chalk pieces. So because of the nasal septum deviation and it is also called nasal obstruction. And there is any foreign bodies in the nose. So foreign bodies like any insects or any chalk piece or any pencil and the children's can be kept into the nose. So because of the any foreign bodies, it is also cause the nasal obstruction. So because of the foreign bodies presence in the nose, and it is also cause the blockage of the nose. So there is a next one is the large adenoids. So the large adenoids it is become gland. So there is a situated into the behind the nose and the roof of the mouth. So the adenoids become enlarged. So because of this enlarged adenoids, the nasal obstruction can be occur. So the adenoids it is a gland and adenoid gland, and it can be situated at the back of the nose and the roof of the mouth, and the adenoids become enlarged, and it is also cause the nasal obstruction. So the next one is the swelling of the lining of the nose from allergies. So because exposure to the any allergens, and there is a swelling can be occur in the lining of the mucosa. So there is a swelling can be occur in the lining of the mucosa of the nose. So it is also because of the swelling, and there is a nasal obstruction can be occur. So next one is the conal atrasia. So the conal atrasia means there is a, it can be present, it is a congenital disorder. So by birth itself, and it can be occur. So it is called as conal atrasia. So in the conal atrasia, what will happen? The back side of the nasal passage is become blocked. So because the back side of the nasal passage is become blocked, so it is called as conal atrasia. So conal atrasia ante by birth lone idi attack avutadi. So during the fetal development only the conal atrasia can be developed. So ఇందులో కోనల్ అట్రేషియాలో నేసల్ ప్యాసేజ్ యొక్క బ్యాక్ సైడ్ ఏదైతే ఉంటుందో అది బ్లాక్ అవుతుంది. సో దీన్ని కోనల్ అట్రేషియా అంటారు. సో ద బ్యాక్ సైడ్ ఆఫ్ ది నేసల్ ప్యాసేజ్ బికమ్ బ్లాక్డ్, అండ్ ఇట్ ఈస్ కాల్డ్ యాజ్ కోనల్ అట్రేషియా. సో ద నెక్స్ట్ వన్ ఈస్ ద పైరిఫార్మ్ అపర్చర్ స్టెనోసిస్. సో the pyriform aperture stenosis. So the pyriform aperture stenosis means there is a narrowing of the front of the nose. So the nostrils which are present in the nose, and it is become narrow. So because of the overgrowth of the upper jaw bone, and there is a narrowing of the opening of the nose. So there is a pyriform aperture stenosis means there is a narrowing of the front of the opening of the nose. So ఏదైతే నాస్ట్రిల్స్లో రంధ్రాలు ఏదైతే ఉంటాయో అవి నారోగా చిన్నగా ఉంటాయి. దేనివల్ల అంటే అప్పర్ జా పై దవడ ఏదైతే ఎక్కువగా పెరగడం వల్ల ఈ నాస్ట్రిల్స్ అనేవి చిన్నవిగా రంధ్రం అనేది నారోగా ఉంటుంది. సో ఇట్ ఈస్ కాల్డ్ హ్యాస్ pyriform aperture stenosis. So in the pyriform aperture stenosis, there is a narrowing of the front of the opening of the nose, and because of the overgrowth of the upper jaw bone. So it is called as pyriform aperture stenosis. So the causes includes the inferior turbinate hypertrophy and deviated nasal septum, and foreign bodies in the nose, and large adenoids, and swelling of the lining of the nose from allergies, and conal atrasia, and pyriform aperture stenosis. So these are all the causes can cause the obstruction in the nose. So the next one is clinical manifestations. So the clinical manifestations includes the breathing difficulty. So because of the obstruction or the blockage, and the patient may have the difficulty in breathing. So because of the blockage of the nose, and the breathing can be taken by the mouth, and when comparing with the nose, so there is a mouth breathing can be occur, and breathing difficulty can be present. So from the mouth the patient will take the breath. So So it is a clinical manifestation, breathing difficulty and mouth breathing. So the next one is the diagnostic evaluation. So the diagnostic evaluation includes the complete medical history. So the medical history includes the previously any surgeries or any related to the nose problems is present or not. We can collect the history in the medical history. So the diagnostic evaluation includes the complete medical history and CT scan and MRI scan. So it can be to identify the nasal septum deviation. So the bone is deviated from the normal position or not. We can identify by the CT scan and MRI scan. So the next one is the nasal examination. So the nasal examination, we can observe the interior part of the nose and we can observe the any abnormalities present or not. We can identify by the nasal examination. So the diagnostic evaluation includes the complete medical history, CT scan and MRI scan and the nasal examination. So the next one is the management. So the management includes the nasal steroidal spray. So the spray can be used to reduce the inflammation and pain in the nose related problems. So the management includes the nasal steroidal spray. So it can be used to reduce the inflammation and infection. So the next one is the surgical management for the nasal obstruction. So in the surgical management includes the septoplasty. So there is a septoplasty means there is a nasal septum deviation can be present and it can be recorrected by the septoplasty. So the septoplasty, in this septoplasty the nasal septum deviation can be corrected by the septoplasty. So the next one is the turbinate reduction. So the turbinate reduction, it includes the turbinate bones can be present in the nose and because of the malposition and improper position of the turbinate bone and the reduction can be done. So the turbinate bone can be removed by the turbinate reduction. So the next one is the surgical removal of the adenoids. So the adenoids also cause the nasal obstruction and the adenoids can be removed by the adenoidectomy. So it is the surgical removal of the adenoids. So it is the surgical management includes the septoplasty and the turbinate reduction and surgical removal of adenoids, that is called as adenoidectomy. So it is a surgical management for the nasal obstruction. So it completes the nasal obstruction.